for more details on World Prematurity Day that's being commemorated today. We're now joined live in studio by Duncan Harvey, the director of Save the Children Kenya. Welcome to Africa Live.
Good afternoon.
Well, if we look at the report that's just been released, it indicates that baby boys are more likely to die from a premature birth. Why is that?
Well, it's true. Among the 1.1 million deaths per year that you rightly presented here, we're finding that actually boys are 14% more likely to be born prematurely than girls. So a number of reasons for this. Girls mature more rapidly in the womb than boys, so they're born with their lungs, their internal organs are more developed at the time of birth. We also know that women who are pregnant with boys are more likely to suffer things like preeclampsia, high blood pressure, and other complications which may contribute towards preterm births.
So it's a case of if a baby is born too early, he's more likely to be a boy than a girl. But if we look at Africa and difficulties that people have in terms of accessing facilities, what is being done to ensure that there aren't complications from preterm birth, so at least something is done to counter that?
Well, Save the Children and other organisations are working together to really ensure, as you say, that women living in rural areas, marginalised parts of the country are really able to access effective care and treatment. I was in the northeast of Kenya earlier this year and I met a woman called Amina who had lost two children soon after childbirth, and she was describing the difference that had made having a health clinic in her neighbourhood, having a trained birth care attendant, someone who could not only be around at the time of her birth, but also advise her on proper nutrition prior to birth, the importance of exclusive breastfeeding, and also knowing that in the health centre there were treatments available from antiseptics, antibiotics and other simple treatments, low-cost treatments that we know have been extremely successful in other countries in reducing the numbers of children dying preventable deaths.
Now, according to Save the Children, do you think African governments are doing enough in terms of that education during pregnancy and after?
Well, I think Save the Children, none of us will be happy until we see a complete eradication of preventable deaths of children under the age of 5. We're still seeing, despite all the progress that's been made in the last 20 years, there are still 6.6 million children dying globally from preventable causes. And I think you presented some of the statistics of what's been achieved in Africa. So despite the progress, we think there's still a huge amount that can be done. We're calling on governments today really to have a renewed commitment to reducing the numbers of preterm births and the deaths and disability that result from those.
All right, thanks so much for your time today and those insights into preterm births. We're speaking there to Duncan Harvey, Director of Save the Children.